When opening the pipette packaging, take care to only handle the top bulb of the pipette to avoid contamination. The four main parts of the pipette are the upper bulb, the lower bulb, the shaft, and the tip. Treat the pipette similar to an eyedropper where the top bulb is squeezed first before the pipette tip is inserted into the specimen tube. When the upper bulb is released, liquid will flow up the shaft and overflow is meant to fall into the lower bulb. It is meant to remain there because it helps to ensure the full volume of measurement in the shaft prior to loading the sample into the device. Be sure to visually check to confirm there are no air pockets or bubbles in the shaft prior to loading the sample into the device. The pipette is designed to deliver the required amount of sample to perform the test. If air pockets or bubbles are in the shaft, an operator may squeeze the sample back into the tube and try again. Remember to squeeze the pipette prior to inserting into the liquid. The pipette tip should touch the bottom corner of the well when inserted into the port. Then, gently squeeze the sample into the device. Once the sample is added, be sure to pull the pipette tip out of the liquid line, otherwise liquid may aspirate back into the pipette. Some liquid will remain in the lower bulb. This is expected. After the sample is loaded into the device, immediately dispose of the pipette to avoid contamination. We will now review two common pipetting errors. The first is due to inverting the pipette. An operator should always keep the pipette tip facing downwards. Inverting the pipette may create unwanted air pockets in the shaft, which would impact the volume being loaded into the device. The key takeaway is to remember to keep the pipette vertical until the sample is added to the device. Remember, we are loading one pipette full. No more, no less. To avoid aspirating liquid back into the pipette, be sure the pipette tip touches the bottom corner of the well while dispensing the sample. Avoid aiming the tip of the pipette into the center of the well. Remember to keep the top bulb of the pipette squeezed as you remove the tip out of the liquid line, otherwise liquid may aspirate back into the pipette.